Dalwaise malungil sil sa Morcaulo mes oring sertial tokubet sa programmer alsil sa Ministry of Health and Human Services sa girela COVID-19. Alsil sin Sunday February 6 di sokan telteale ma marenga sulir adra Eco Paradise FM mal Sunday kama matmok kertial tokubet sa programmer alsil. Tiang ade kalbol waigel regular updates and kalbol dosada gays and by teal mesoma masanga Dr.Thane Hancock todeng lo sengal toktanga mlamo edel Sunday ranmel o neseur kumamara long seur gid ra Ministry of Health and Human Services ra ganomre edel Sunday kuk malasam ngatmok laigel katmagil mamoklo tutele lurior lirela a response gid and mortial the surge ra COVID-19 matial program malgora di kadebe togubetsel el program le sama masate ele langal toktang mangukora maskida osengel legal mlamomre del Sunday madirek kalte ele gukora asma daigel guk osengel del bedulu ay bedulu legal maral melte al Sunday lo ser de gire del motmok gire la a possibility ra guk tara variant mal ubang guk tara surge mingire del di gergik gire say gide akora mukte katel togubets el program el alsils. So, Dr. Thane, thank you, first and foremost, on behalf of the Ministry of Health and Human Services. I know this is the third week, if I'm not mistaken, or the fourth week, actually, since you joined us back in, I think you arrived January 13th. I was just explaining to the audience that this is not a daily update, but rather a special program, an opportunity for us to provide you that opportunity to perhaps look back over the past 3 weeks that you've been with us and talk about some of the things that we've been able to accomplish both at the ministry and of course out in the community with what we've been able to achieve. And then also perhaps before you leave tonight, just give us some parting thoughts on what we should be expecting in the near future, and perhaps talk a little bit about the possibility of new variants and what we should always be preparing ourselves for after this surge. Perhaps we can start off with that.
Thank you, Minister, and I really appreciate this opportunity to not only wrap up with you, but really to be able to chat with the other folk, the rest of Palau, because really, as you know, I deployed quickly down here for at the request of your ministry by the U.S. Centers for Disease Control and Prevention to support Palau's response to COVID-19, and it's really a whole community response. And certainly, when I first arrived, I think we were all a bit anxious about and uncertain of what we would be expecting over the next few weeks in Palau as the Omicron variant started to move through and move in the community. Working with your ministry, I've really been impressed with the speed that the community and the ministry was able to adapt the approach to meet the new challenges that Omicron, that variant, brought versus what we had all been preparing for with the other variants. I think over the past 3 weeks, there's been a lot of amazing things that the ministry and the community has done that has really helped protect Palau. And really, in my opinion, Palau is on the right track. You guys are getting through this. Each day is a day closer to the end. And I'm leaving much more optimistic than when I arrived. Since I came, approximately 5,000 more people received boosters in these last 3 weeks, and that's so important for protecting the community. The hospital team has been amazing in being able to expand their ability to not only manage COVID patients, but also the number of patients there. Your ministry also adapted and created this community COVID care clinic where people who have mild symptoms of COVID, which we are seeing the vast majority of people in Palau when they are infected with COVID-19 because of their vaccination and boosting, has been very mild. And that clinic has been great. It's really a model that we have all been really impressed with, where people who are high risk for developing severe COVID are able to get access to these really new and quite outstanding therapies that can really reduce the chance of that person developing severe COVID. And of course, those are being supplied by the U.S. federal government and are available to Palauans now. So that's great. And then I think the other big thing is the community testing, right? So you really expanded the ability of the community to get tested. For people who are high risk, they can know if they have COVID and get those therapies. I think that's important for people to remember moving forward. Again, if you're someone who's over 65 or 60 years old, or if you have diabetes, or if you're overweight, or you have high blood pressure or problems with your lungs, and you test positive for COVID, if you come early in your course of disease, when you first start having symptoms, there are very good medicines that can help reduce your risk of developing severe disease. So make sure you come to that COVID care clinic near the hospital, Kalau Gym, if you have that. And then, a lot of this outreach activities into the communities. There's been mobile community care clinics up at north, and of course a trip to Peleliu earlier this week to really try to bring testing, therapy, and additional boosters out to the community has been really amazing. I think even with all of those great achievements, the most important thing that I've seen over the past 3 weeks, and we hope that it continues, is that the number of people who are having severe symptoms or severe disease because of COVID is incredibly small. We really haven't seen people who are developing, who need high levels of oxygen even yet. And not that that won't happen, as this pandemic and this virus moves throughout the world and in Palau, of course, we know that can happen. But right now, the hard work that the community did to get vaccinated and boosted, I believe is really paying off. So we're starting to see numbers. If you recall, 3 weeks ago when I arrived, numbers were just accelerating. Each day was more and more cases, and twice as many than the day before. But now cases have stabilized. They plateaued a bit. We hope that may mean that in a few weeks we're going to see potentially some decrease in cases, but only the Lord knows truly what's going to happen, but that is a optimistic sign that cases are flattening a bit. And I think, as far as what to expect in the future, I think one thing is, as you guys move, and especially because of this great effort to vaccinate and boost folks, as well as these additional therapies, it really reduces the danger of a COVID infection. And the community already, I think I'm starting to see Palau looking at how do we live with this virus, live with this new normal. And I think one big part of that is, and I see that your leadership is already looking towards how do we get our kids back to school and back to learning, which is, of course, incredibly important for their development as children. So I think, I'm aware of many of the efforts within the school systems to help reduce the risk that kids get infected while they're at school. And we know, unfortunately, that the virus is moving very easily in homes right now. So likely kids might be at higher risk of getting infected outside of the school than in the school with the interventions that they're putting in. The other good thing is that kids generally, if they get this virus, they do very well with it. It's a very small chance that kids develop severe disease. So it's for childhood, it's a mild illness. But I think the big risk that people worry about is, well, will the kids bring the virus home? And that's certainly possible. They could bring it home, and might they infect grandma or grandpa who are at risk of severe disease? And really, the best way to protect grandma and grandpa is through the vaccination and boosters, not necessarily by keeping the kids isolated and away from learning, but rather making sure that those that are older or those that have other diseases or illnesses or health conditions that put them at risk get boosted. there's new data, and this data wasn't available when I arrived 3 weeks ago, but there's new data showing that people who are vaccinated and boosted are 97 times less likely to die of COVID than an unvaccinated individual. So it really helps reduce that risk. And then, again, just want to reemphasize, if those elderly or high-risk people do develop COVID and have some symptoms, even if you feel like it's mild, do come in and get that additional therapy, which then lowers your risk even more. So I think there's a lot of layers of protection there. I think Palau is really on the right track. I've been so amazed with the ministry's work, but really all of Palau's effort. I mean, it really takes everyone working together, and that, and really showing compassion to each other. I think folks are realizing that COVID-19 is no longer an outside virus, an outsider's virus. It's here in the community, and unfortunately, members in the community have it, and you can't blame these individuals. This virus is super infectious, it's moving, but Palau has really done a great job at turning this really big bad virus into something that's much more mild through vaccinations and boosters. Yeah.
Thank you, Dr. Thane. There's also talk about this new subvariant of Omicron, and perhaps you can shed a little bit of light on that, on how concerned we should be given where we're at now, and given our vaccination status and what all the things you've just talked about in terms of getting ourselves more prepared. So any insight on that?
Yeah, thank you. So I think we're still learning, and again, trying to be someone that's going to predict the future during the time of COVID is, it's a fool's errand. I'm gonna, of course, no one can predict it, but at least with this new variant, the BA.2, which is a subvariant of Omicron, it looks like it's potentially more infectious than the current variant of Omicron that we're likely experiencing here. But doesn't look like it causes more severe disease at this point. We'll see. Again, the data's early on that. But the big thing is that it does look like if you've gotten and recovered from Omicron, that you would also be protected against the BA.2 is what it's looking like so far. But discussing this new variant, I think, brings up a real important point, that we don't know what the next variant may be. And so I think the big lesson, and it's really a lesson that I think the world is learning, potentially could learn from Palau, is that ability for the Ministry of Health, the whole nation, and the community to really recognize that you have to be quite agile and adapt your policies to really meet the new challenges that these variants throw at you. It's in a way, it's like you're playing a basketball game against this virus. It's a war, or whatever it may be. But when it makes a move, you have to adapt and change to that. And so I think maintaining that ability to be flexible and think about, all right, there are certain interventions that we may need to put in place again if a different variant pops out, depending the characteristics of that variant, is really important. The bottom line is your commitment and the community's ability to get vaccinated and boosted is really the foundation of all your response and ability to fight any SARS-CoV-2 virus at this point. But, there may be additional boosters down the road. There may be new therapies or medications. But I think that ability of the ministry and the community to work together and adapt is really important.
Thank you. And I think on that note, I really want to thank the community on behalf of the ministry for really taking the initiative to wear a mask, even though there's a mandate in place. But I think people are doing it not because they're mandated to, but because of their willingness to follow the science and to do what's right for themselves and others. And I think that's something that I really want to thank the community for. I think it's the first time ever that we've had to mandate any sort of public health intervention community-wide, apart from the quarantine and the entry testing requirements. So that's something that we're really thankful for in terms of community support and cooperation for that. And I think you're right. Moving forward, we're seeing in the news a lot of other places around the world that have gone through or are still going through the surge even of Omicron are starting to ease restrictions. But I think at this point it's too early to try and dismantle all of that. But we'll definitely keep monitoring our own situation and see where we're headed before we start looking at that. But it is wishful thinking that in the next couple of weeks, maybe in 4 weeks' time, we'll be able to stop wearing masks if we ever reach that point. But yeah, I think you're right that we have to make sure to be aware of what could be coming next, and always be agile. So thank you for that. Any last comments or thoughts?
Yeah, I have just and just to hit on these final messages and just really emphasize it is, again, getting vaccinated and boosted is so important, especially if you're older or have a health condition. And so really want to encourage, the ministry is still providing boosters for those that need it. So if you haven't been vaccinated yet or you haven't been boosted, do come in, get your vaccine, get your booster. I know some people may not be able to get their booster yet. If it's been 5 months since your last vaccine or your third dose, after your second or third dose, you can get that booster. So get it. And then just to re-emphasize, it's really important that people know that if you are older, if you have diabetes, if you're overweight, if you have high blood pressure or heart disease, and you get COVID, don't wait till the symptoms are really serious before you come to the hospital. Once you start having symptoms, come in early and get one of those new therapies that really are good, and they really help reduce your risk of winding up in the getting sick where you need to wind up in the hospital. So that's the second thing. And then lastly, I think just want to re-emphasize, Palau has been so amazing in your ability to stay connected, work together, show compassion to each other as you fight this virus. As you know, elsewhere in the world, this virus really divides people and can create a lot of friction and uncertainty in families and the community and the nation. And I just want to recognize Palau's ability to continue to work together, show respect to each other, and that that's what's going to make your response different than any other place. And speaking of coming together, do know that, although I'm leaving now, there are other folks from CDC here. And of course, you have our consistent support from the wider U.S. federal government. It's an honor to be able to work alongside Palau during such a historic and important public health emergency. And that will continue. We always, we're honored to be able to work alongside the Ministry of Health as well as the people of Palau, and that will continue moving forward as well.
Thank you, Dr. Thane, and likewise, it's always incredibly. We're very much appreciative of the support, the continued support and partnership that we have with the U.S., and especially right now with this pandemic. And of course, there's other health issues that we need to address, including NCDs and other communicable disease, which we have different programs and initiatives, especially with the federal funding that we get in the program. So thank you for joining us again. And we do hope that you'll be back again. If not for a vacation with your family, then we'll be able to work on other things as well. So thank you on behalf of the ministry, and we wish you a safe trip back home.
Thank you very much.
Malalway sa kuman sulang, updaw ngira update raklo.